Welcome, everyone, to Newly Diagnosed Metastatic Next Steps. My name is Mary Ellen Rogers, and I'm a certified patient navigator with the Breast Cancer Resource Center, or BCRC, a community health worker, as well as an 8-year breast cancer survivor. For those of you who are local and in our service area, know that we will go over BCRC services at the end of this presentation. When you first receive a breast cancer diagnosis, your life is turned upside down. The goal of this video is to provide you with information that answers a majority of the questions that you may have when you're first diagnosed. We'll discuss breast cancer basics, answer common questions about your diagnosis and treatment, take you through the many steps, procedures, and terms that you might need to know when you're newly diagnosed with breast cancer, go over your healthcare team members and their roles. We'll discuss practical tips and provide resources. We will also define patient navigation and finally give you information about BCRC and how we might be able to help you as you move through your diagnosis and treatment. It takes time to develop your diagnosis and treatment plan. Once you have the biopsy, the pathology report will be referred to a surgeon and/or a medical oncologist. There's going to be many appointments, phone calls, and testing to be completed before your treatment can begin. The surgeon and/or medical oncologist may have you scheduled for a CT scan, a breast MRI, additional blood work, possibly a visit with a genetic counselor for genetic testing, and more. So the questions you see here will be answered at some point by your surgeon and medical oncologist, but it is inevitable that you will continue to think of more questions as you go through the diagnosis process, and that's completely normal. Your pathology report has a lot of information about your breast cancer, and it can be very overwhelming to sift through. The details that we discuss here are not inclusive of what you will find in your report, but they are all important in classifying your cancer. There are many different sections of the report that give you different information about your diagnosis, including different descriptions of your biopsy sample and your final diagnosis. We won't go over each section, but this guide produced by breastcancer.org has great explanations of each section. You can also access the information on their website. The special tests markers section summarizes the most important characteristics of the cancer. This may be longer or shorter, depending upon the style of the pathologist. The final diagnosis usually describes the type of cancer and will likely include some of the markers that you'll see on the slide. While I'm not authorized to go over specific parts of your pathology report, once you do go over that report with your team, we recommend that you speak with the oncology nurse or a navigator who will be happy to clarify anything that may be confusing. Metastatic breast cancer is when breast cancer spreads to other parts of the body. As you can see in the diagram here, these are the most common sites breast cancer may spread to, but that doesn't mean it can't spread to other areas such as the skin. There are 2 ways metastatic breast cancer can be diagnosed. Metastatic cancer that is found as the initial diagnosis is called de novo. Alternately, about 30% of early stage breast cancer cases develop into metastatic breast cancer after the initial diagnosis has been treated, and this is referred to as recurrence or progression. Many times metastatic cancer will be referred to as stage 4 or advanced stage cancer, and these terms are used interchangeably. Many times breast cancer will be described by its stage. Staging is used by your medical team in order to understand your prognosis, guide your treatment decisions, and provide a common way to describe the breast cancer so that treatment results can be compared and understood. The most common tool that doctors use to describe the stage is the TNM system. Doctors use the results from the diagnostic tests and scans to answer these questions. Tumor, T. How large is the primary tumor in the breast? What are its biomarkers? Node, N. Has the tumor spread to the lymph nodes? And if so, where, what size, and how many? And then metastasis, M. Has the cancer spread to other parts of the body? Treatment for metastatic breast cancer depends upon the type of tumor and can include any combination of the types listed here. Metastatic treatment will slow or might even stop the spread of cancer, but it will not cure the cancer. The goals of treatment for metastatic breast cancer are to control the cancer for as long as possible and to help you maintain your usual daily activities. During your treatment, you might hear the term NED, or no evidence of disease. And this means there is no physical evidence of the disease after examination or tests as a result of treatment. The most important thing to remember, though, is that no two clients will have the same treatment plan. Everybody's different, and each treatment plan will depend upon the type of breast cancer. So as difficult as it is, try not to compare your treatment plan to someone else's because there's so many factors that contribute to your personal plan. If your metastatic disease is a recurrence, another thing to note is that your treatment this time around may be very different, and most times won't use drugs as potent as the last time your cancer was treated. There are additional therapies and treatment options that you and your medical team might choose to explore. Clinical trials are usually very selective and require participants to meet specific qualifications, but they can provide access to emerging treatments. Palliative care is not treatment, but an area of medicine that works to provide patients with comfort, pain management, and help to manage side effects. There are also many types of integrative therapies that you can utilize to manage your side effects. These will complement your treatment. We will discuss these therapies in more detail. A clinical trial is a research study involving human volunteers that is designed to answer specific health questions. Clinical trials are the safest and most effective way to study breast cancer prevention, to improve breast cancer diagnosis and treatment, and to address the needs of breast cancer patients. There are two main types of clinical trials: observational and experimental. Observational studies are used by researchers who want to look at patient outcomes based on their current treatment. These types of studies do not test new drugs. Rather, they are used to identify any potential trends based on a variety of factors such as diagnosis, gene mutation, treatments, age, race, etc. The other type of clinical trials is experimental. These trials focus on new treatments to learn if a new treatment is safe, effective, and possibly better than the existing treatments. These types of studies evaluate new drugs, different combinations of treatments, new approaches to radiation therapy or surgery, and new methods of treatment. Many experimental clinical trials are randomized controlled trials, or RCT. And this means that there are at least two groups, each receiving a different treatment. Participants are randomly selected and put into one of the groups. You may have heard of placebos in reference to clinical trials, where one group will not receive any treatment. But in breast cancer clinical trials, there are not placebo groups. Instead, there might be a group receiving the experimental treatment, and the other group will receive the current standard of care treatment. This is done so that every participant is still receiving some type of treatment for their diagnosis. Trials can be blind or double-blind. In blind trials, the participants do not know which group they are in, but the researchers running the trial do. In a double-blind trial, both the participants and researchers do not know which group the participants are in. This decreases any potential bias. For more information about clinical trials or to see if that is an option for your treatment, please consult with your oncologist and visit breastcancertrials.org. Beware of Dr. Google. There is so much information about breast cancer on the internet, a lot of which does not come from credible sources. It's important that when you have questions or you're looking for information about your diagnosis, that you go to credible sources that are backed by science and research. Some of the sources that we recommend are listed on this slide. One topic that might not get brought up when you're first diagnosed is your fertility. However, if having biological children is something that you want to consider, it's recommended that you have a conversation with your oncologist before beginning treatment. Many of the treatment options your oncologist will recommend can affect your fertility. Your oncologist can recommend you to a fertility specialist who will go over your options before treatment begins. And the slide lists some of the questions that you might want to ask regarding your fertility. It is recommended that you see the fertility specialist to discuss the costs involved. There is financial assistance available. So visit the BCRC website for the list of possible financial resources. For example, the SAM Fund Family Building Grant is a helpful resource for anyone between the ages of 21 and 39 who wishes to move forward with fertility treatment options. Palliative care, sometimes called supportive care, is medical care that focuses on relieving symptoms and side effects from your treatment. People who receive palliative care along with treatment for the cancer often have less severe symptoms, better quality of life, and are more satisfied with their treatment. You may have palliative care at any age and for any type and stage of cancer. Because palliative care has so many benefits, we recommend that you begin seeing a palliative care doctor early in your diagnosis and treatment. Palliative care is not hospice. These are two types of care serve two very different purposes. Integrative therapy describes products or practices that can be used in addition to standard medical care. Some examples of these include meditation, exercise, acupuncture, massage, medical marijuana, and art therapy. When these therapies are combined with standard treatments such as chemo or radiation, this is referred to as integrative medicine. As always, it is important to have a conversation with your medical team before you begin any new treatments or therapies. You'll want to be sure that your oncologist is in the loop and make sure that any therapy that you are interested in will not interfere with your treatment plan. Your healthcare team is made up of so many different medical professionals, and each plays an important role, which I'll go over shortly. It's important to know that this team is fluid, and just because you have been referred to, say, an oncologist, for example, that doesn't mean you need to stay with that doctor for your entire treatment. Decide whether you want second opinions after your initial consultations. Definitely check with your insurance, though, to see how many they allow. But know that you have the right to seek other doctors out and change if it's not a good fit. You must be your own self-advocate, and there will be many decisions for you to make. Your medical team consists of healthcare professionals whose job it is to make sure you are informed and prepared for treatment. Remember, you can and should ask questions and become an active member of your team. Physicians work together to follow your case and discuss your treatment. Your medical experts include medical oncologist, manages your overall cancer care, including identifying appropriate systemic treatments, as well as clinical trials if necessary. Surgeon plans the surgery and removes the tumor. Plastic surgeon performs breast reconstruction after breast surgery. Primary care doctor attends to your general healthcare needs. Radiation oncologist treats cancer by transmitting high energy radiation to shrink and kill cancer cells. Don't forget the dentist, best to see prior to starting any chemo. The palliative care physician helps to manage potential symptoms from different medications. Oncology nurse, they will coordinate with your medical oncologist. A nurse navigator, often affiliated with a hospital or oncology practice. The nurse navigator coordinates your clinical needs and can answer questions about the clinical aspects of your diagnosis and treatment. Your nurse navigator might also coordinate your care with your medical oncologist. Patient Navigator, trained professionals who work closely with the clinical team by offering guidance, education, assistance, and access to community resources appropriate for your needs. Social worker and financial counselor provides counseling on financial or family concerns during your treatment. A nutritionist can help with diet to manage side effects. A physical therapist might be needed after surgery to help you with range of motion. A mental health specialist or therapist can help you work through any emotions or difficulties you might be going through. A recent breast cancer diagnosis is both scary and confusing, among many other things. So now I'll go over the top priorities for you and how to navigate those priorities. One of the first things you should do, if you haven't already, is look into your insurance. If you are insured, find out what your policy covers. If you have questions, a patient navigator or financial counselor may be able to help. If you're uninsured, ask a patient navigator or financial counselor about what programs that you might qualify for. Triage Cancer is another good resource with information not only about health insurance, but on many legal and financial aspects of a cancer diagnosis. Every employer has different policies for taking extended time off, and there are many different types of leave. We recommend reaching out to your HR representative to learn more about your specific time off policies. Cancer and Careers is a great resource that empowers and educates anyone with breast cancer or any type of cancer. They have experts who can share advice as well as interactive tools and educational events. If you have been diagnosed with metastatic breast cancer and are undergoing treatment, you may find that you are no longer able to work and earn a living the same way that you were before your diagnosis. Disability insurance may provide you with some income if you are unable to work because of your medical condition. Disability insurance benefits are offered by the federal government, some state governments, or through a private insurance company. Social Security Disability Insurance, or SSDI, and Supplemental Security Income, SSI, are both federal programs that provide financial assistance to people with disabilities. And both are administered by the Social Security Administration, SSA. To qualify for disability benefits from the SSA, you must have a disability within the SSA's definition of disability. For SSDI, you can be considered disabled under Social Security rules if all of the following are true. You cannot do work that you did before because of your medical condition. You cannot adjust to other work because of your medical condition. Your disability has lasted or is expected to last for at least 1 year or to result in death. Supplemental Security Income, SSI. You may qualify for SSI benefits if you have a low income level, income limit can vary, and are age 65 or over, or you're blind or considered disabled. For further information about disability, you can refer to the SSA website. We also recommend that you talk with your oncologist to discuss if applying for disability is the correct option for you. Some people are able to work as long as their side effects are managed. Metastatic breast cancer patients frequently request financial assistance for direct medical costs. Could be copays and deductibles, the related non-medical costs such as transportation, gas, childcare, or your daily living expenses like rent and utilities. This list is not all-inclusive, but it shows some of the possible resources that might be available. Your social worker at your cancer center is a good resource for finding available financial help, as well as your Patient Navigator. One reason receiving your cancer diagnosis is so overwhelming is because there's so much to keep track of. Chemo brain, or brain fog, is a common result of cancer treatment that can also impact your ability to keep track of everything. One thing that seems to be helpful for a lot of our clients is keeping a binder to organize things such as medical appointments, questions to ask each doctor, your medical records, copy of reports that you receive, medical bills, prescriptions, etc. Some of our clients will enlist the help of a family member or friend to help them keep track of all the paperwork. Many also use a spreadsheet to track their lab tests and scan results from each visit. And chances are, once you start sharing your diagnosis with your friends and family, there'll be so many people who want to help, but they might not know how to help. Having a list prepared of things that you do need help with will be important when someone comes to you and asks, so what can I do to help? Some things you might consider having people help with could include childcare or play dates, transportation to treatment, medical appointments, surgery, helping to clean the house, bring over meals, lawn care, walk the dog, grocery shopping, picking up the prescriptions. There are some great resources that you or friends and family can use to help coordinate or, just help keep everyone updated. Caring Bridge is a website that you can use to create a page where you can share any updates with your friends and family. It can be very overwhelming to have to constantly give your loved ones the same update individually, And Caregivers is helpful. So you can give everyone the link to your page, and then they can read it whenever you make an update. Cleaning for a Reason, if they are available in your area, offers 2 free house cleanings. Meal Train is a great way for your support system to organize meal deliveries for you as you're going through treatment or surgery recovery. Care Calendar is another website that combines everything from meals, transportation needs, updates, and gifts. A friend or family member can keep the calendar updated for you. Lots of Helping Hands is similar to Care Calendar and helps coordinate meals and extra support. And then Amazon Wishlist is a great tool that you can use if there are certain items that you need and your people can purchase them for you. We know it's not always easy to ask for help, but having that support from your family and friends during this time in your life can be so helpful. These are some helpful tips that you can share with your loved ones when they ask, how can they help? Listen. One of the easiest ways a loved one can help is to just listen. A lot of times you might just want someone to talk to without them being a cheerleader. Support treatment decisions. If you feel comfortable, you can invite your loved ones to share decision-making with you. Just remember that every treatment decision is ultimately your choice. Giving them specific things they can help you with. The list on the previous slide provides a lot of concrete things your loved ones can help you with. It might be frustrating when somebody says, call me if you need anything. So having that list ready will make it a little easier when someone does offer their help. Staying connected. If you choose to make a personal webpage to update family and friends on your treatment, try to keep it updated as you continue through your treatment or make any changes so that you can continue to receive the support that you need. And then keeping things normal. Your cancer diagnosis can be very isolating, and a lot of times loved ones try to help by taking over everything and leaving nothing for you to do. Keeping a somewhat normal schedule can help when going through treatment. For instance, if you enjoy cooking and you feel up to it, tell your friends and family you would rather cook dinner instead of having them make it for you. Retreats are a great way to practice self-care. There are retreats for the individual patient as well as some for the family or couples. Nancy's list has an extensive list of available retreats. Most are free. You may need to provide your own transportation, but some may have scholarships available for those who need financial assistance. We highly recommend you apply for family retreats, but also create a legacy movie for your loved ones. Check out the website for Memories Live to get more information about how you can create this movie virtually. Here are some helpful tips our metastatic clients have shared. 1, it's important to take care of your mental health. Seek out professional counseling, talk with your navigator, attend a support group. Play Sudoku, video games, and puzzles will help maintain your cognitive ability and relieve stress. Get connected to online forums. And check for Facebook and other groups specific to your treatment or diagnosis. Metastatic breast cancer myths and misconceptions. Metastatic breast cancer is curable. Whether metastatic breast cancer, MBC, is someone's first diagnosis or recurrence after treatment for earlier stage breast cancer, it can't be cured. However, treatments can keep it under control, often for months at a time. People with MBC report fielding questions from family and friends such as, when will you finish your treatments? Or, won't you be glad when you're done with all of this? But the reality is that they will be in treatment for the rest of their lives. People with metastatic breast cancer have a short amount of time left. While some people mistakenly think MBC is curable, at the other extreme are those who assume it's an immediate death sentence. But there's a big difference between stage 4 incurable cancer, which MBC is, and terminal cancer, which can no longer be treated. A person isn't automatically terminal when he or she gets a metastatic diagnosis. Although MBC almost certainly will shorten someone's life, it often can be managed for many, many years at a time. People with metastatic cancer look sick and lose their hair. No, all treatments are different and not all will cause hair loss. But you may look normal but not feel so not well or normal during your treatment. Metastatic breast cancer requires more aggressive treatment than earlier stage breast cancer. The goal is to control rather than cure. Think of it as a marathon versus a 50-yard dash. If you're diagnosed with metastatic breast cancer, you did something wrong or didn't get the right treatment the first time. A person can still do everything right and still get MBC. Metastatic breast cancer is a single type of cancer that will be treated the same for every person. There is the misconception that there is one standardized treatment for every case of MBC, like a one-size-fits-all. But there are different approaches, and it can't always be said that one approach is better than another. Most people don't realize that there are different subcategories of this disease. When breast cancer travels to the bone, brain, or lungs, it then becomes bone cancer, brain cancer, or lung cancer. No, it's still breast cancer that has spread. If an earlier stage breast cancer is going to recur as metastatic breast cancer, it will happen within 5 years of the original diagnosis. Distant recurrences can occur several years or even decades after an initial diagnosis. The mental and emotional experience of people with MBC is the same as that of earlier stage patients. Clearly, the experience of metastatic breast cancer is quite different from early stage breast cancer. But there are so many patients who understand just what you're going through. Read more about living with metastatic breast cancer at breastcancer.org, and be sure to join one of our metastatic support groups if you are in our service area of Central Texas. So let's talk about patient navigation. Patient navigation helps patients get the care and other resources they need when experiencing a long-term or chronic illness. A patient navigator works with patients, their families, and their caregivers to overcome barriers to cancer, the barriers to cancer care, and support patients after the treatment. We recommend that you connect with a patient navigator as soon as you're diagnosed. A patient navigator who's not a nurse is sometimes called a lay navigator because they're not part of your medical team. Patient navigators may be certified and may also be certified community health workers. While the patient navigator will be able to answer many of your questions, remember they are not medical professionals and cannot answer all of them. It's important to build a relationship with your medical team so that you feel comfortable asking those questions that your navigator isn't able to answer. Nurse navigators are usually part of your hospital team. They are excellent at helping the patient feel comfortable in the hospital system. They can answer medical questions and more that are listed on this slide. In many instances, patient navigators and nurse navigators work very closely together to ensure that all patients' needs are met. If you don't know if there are patient navigators in your area, we recommend that you connect to a social worker, either at the hospital or oncology practice. Some of you may live where there are no navigation services or support programs in your area. Here are some national organizations that offer online support and programs. Make sure to visit the Breast Cancer Resource Center blogs and video resource library. We've recruited subject matter experts to provide trusted information regarding medical, emotional, practical, and lifestyle concerns in both of our blogs and our video resource library. Our video resource library has informational content videos in both English and Spanish. So who's BCRC? In the next few slides, I will discuss BCRC services for those living in the Central Texas area. If you're not in the Central Texas area, we hope you'll reach out to navigation services in your area. Our mission at the BCRC is to empower those affected by breast cancer with personalized support and compassion. We're here to help clients replace fear, anxiety, and doubt with information, options, and hope. Our trained, certified patient navigators, all breast cancer survivors, are easy to talk to, and we understand the process. If you would like to become a client, you will go through our intake and will be matched with a patient navigator. Your navigator will be there with you to provide guidance and information every step of the way. Apart from patient navigation at BCRC, we offer many services to our clients, including outreach, education, patient advocacy, social support, and direct financial assistance when available. All of our services and programs are offered to our clients free of charge, regardless of income, ethnicity, education, sexual orientation, or social support. And we're thrilled that in 2019, we received a 5-year grant from the Centers for Disease Control and Prevention, the CDC, which allowed us to create this video. When a client first comes to BCRC after receiving a breast cancer diagnosis, they're paired with a trained and certified patient navigator. We currently have 5 patient navigators on staff. In addition to their extensive training and certification, all of our patient navigators are also breast cancer survivors. We've been where you are, and we understand what it's like to be newly diagnosed with that whirlwind of emotions, appointments, learning a new language, and we know how daunting that can be. Know that we also offer navigation in Spanish. The one-on-one support our navigators give their clients is unparalleled due to their unique perspective and experience with breast cancer. Our patient navigators help clients with communication issues with care team and loved ones, medical system challenges, coping with emotions, financial concerns or questions, and recommendations and resources for treatment recovery items. Our patient navigators are here to answer your questions and empower you to make informed decisions about your diagnosis and treatment, and just be there for you when you need someone to talk to who gets it. Patient navigators refer their clients to our local and national partners when there's a need for additional trusted resources. BCRC offers several different educational opportunities to our clients. For those diagnosed with early stage breast cancer, we offer a live presentation as well as a recording, and this recorded presentation for newly diagnosed metastatic next steps. Our clients can access current local and national resources through our website. These resources complement the navigation services that we provide and allow our clients to access additional resources we don't specialize in providing. In addition to all of these resources, our patient navigators are constantly working one-on-one with their clients to educate them on certain aspects of their diagnosis, treatment, and navigating additional resources. Our navigators help clients understand certain medical terminology that may be confusing for them. Patient navigators also teach their clients effective communication skills so that they can advocate for themselves and participate in informed discussions with their providers and care team. In addition to the one-on-one guidance from patient navigators, we also offer a number of support groups and online forums for our clients. Clients can also utilize our online forums to connect with other BCRC clients and receive real-time support. We have specific support groups for our clients based on where they are in their diagnosis and treatment process. Additionally, we have groups for our metastatic and young metastatic clients to support their specific needs. And finally, we also have several support groups for our Spanish-speaking clients, women of color, and our young clients under the age of 45. Our support groups and online forums give clients the opportunity to connect with each other on a more intimate level and ask and get answers to any questions that they might have. Clients find these resources very helpful and feel very supported by the members in the groups. Support forums and support groups are facilitated or moderated by patient navigators to ensure a safe space and to help differentiate fact from fiction. BCRC currently provides services to those living in Central Texas. If you have not already, call BCRC or visit our website to become a client. We are here to walk through this with you and be your advocate.